Brittany, it looks like some folks are just on the phone. I can't really tell. But for anyone who's on the phone, who's near a computer, it would be best to be able to view the screen.
Thank you, Tanisha. I think that was a great jump start into our welcome today. So good afternoon, everyone. This is Brittany Mitchell from the Institute for Community Inclusion. As Tanisha said, there is a PowerPoint that's being broadcasted on the screens right now. And the title of today's pre-training webinar is Setting the Stage to Serve the Disability Community. This webinar is part of the Access for All training series that's funded by the CDFI fund. So welcome everyone, and as we get started, I'd like to pinpoint a couple of housekeeping items as far as how to use the Zoom webinar platform. We like to encourage your interaction throughout the webinar presentation using the chat box. You should see a chat icon on your screens, and if you type into the chat box and select in the blue drop-down box menu, all panelists and attendees, that will ensure your message gets to all of the presenters as well as the attendees. So feel free to use that to communicate with us throughout the presentation, both for your questions and comments regarding the content, as well as if any technical issues arise that you'd like us to help address. A couple of other points is that this webinar is being recorded and live closed captioned. If the captions are not being broadcasted on your screen right now, please click the CC icon on the Zoom platform and you should see them being broadcasted. In addition, I will also post a link to the closed captions that you should be able to follow throughout the presentation. Thank you for your attendance, and at this time, I'd like to turn it over to Ms. Tanisha Washington from BCT Partners.
Good afternoon, folks, and thank you for joining us for this pre-training webinar. We look forward to actually seeing you in LA, but this webinar will help to get you prepared for the training that you will receive in LA. As Brittany mentioned, my name is Tanisha Washington. I am the Deputy Program Manager on this program for a company called BCT Partners. Since you're all here in attendance, that means that you have visited the Access for All page and know a little bit about the program. But what you may not know is a little bit about BCT Partners. BCT has teamed with several subject matter experts and with the CDFI fund to be able to deliver this series called Access for All. We are a small business headquartered in Newark, New Jersey, and our mission is to help bring about a more equitable society, and we accomplish that by programs such as this that serve communities that have specialized needs, that are disenfranchised, people of color, you know, and so we have a corporate consciousness, if you will, that drives the type of work that we do, and we're very pleased and grateful to engage in this project and hope that you get a lot out of it. Today's presentation will be delivered to you by one of our subject matter experts, Ms. Toby Parch-Davies. Toby conducts applied research and evaluation projects focused on the social determinants of health and improvements of socioeconomic status of persons with disabilities and vulnerable families. Toby works through the University of Maryland. I should have mentioned that. She pioneered much of the early efforts on asset building for people with disabilities and continues to evolve strategies to improve the social and economic inclusion of persons with disabilities locally, regionally, and nationally in all aspects of community life. And so without further ado, I will turn the mic over to Ms. Toby to begin walking you guys through the training.
Okay, great. Thank you, Tanisha and to Brittany. Welcome to today's webinar, which is to introduce you to the Access for All training series, sponsored by the CDFI Fund. to reach an underserved constituency in your community, people with disabilities. So who are people with disabilities? Many of us have family members, customers, or people we know in the community that experience disabilities. However, disabilities are hidden at times, and you may know people with disabilities already without realizing it. We'll start out today by reviewing the learning objectives, so please advance the slide. And followed by an overview of the population characteristics of people with disabilities in the United States. You can proceed past the disclaimer. Right here is good. Thank you to Brittany. These data and those that you collect as part of your planning process will help you target your networking and stakeholder engagement activities. The more you can do to learn about the disability community before you attend the face-to-face session, the more you will benefit from the series. The information you obtain will be very useful for informing your strategic planning, partnership development, and product development approach. We also want to use our time today to start building the community of the cohort who will be attending the LA session. By participating actively in today's polls, we will all gain a better understanding about who will be in attendance, what is motivating participation in the session, and the types of products and TA supports CDFIs are considering, so that you leave with a plan for implementation. Throughout the session, we encourage you to use the chat box should you have questions. We will pause periodically during the session to answer questions from the chat box as time allows. If there are questions we don't get to, we will follow up with you after the session as soon as time permits. Okay, next slide, please. And the next slide. Thank you. Next slide. Okay, so aims for the Access for All training series. The major aims of the series include increasing your understanding about the demographics and financial service characteristics of persons with disabilities, as well as increasing your cultural competency in customer service. These are all drivers that will help you shape financial products and service delivery in a way that addresses their needs. People with disabilities want many of the same things that your current customers want: jobs, housing, consumer lending products, but the difference may be in adjustments that you need to make in order for your products to be usable and with the product features and characteristics that are important to people with disabilities. There are a plethora of public, private, and voluntary organizations involved in supporting people with disabilities. Our task is to equip you with the networks and the organizations available in your community so you can build relationships with disability stakeholders and to best align your products and your services with the express needs of people with disabilities. Next slide, please. The content we cover in the series, the face-to-face series, and post face-to-face sessions and additional webinar series is rich with history and information about society's treatment of people with disabilities and major social movements related to their ongoing civil rights struggle. People with disabilities are one of the most socially and economically oppressed groups in society, nationally and internationally. This is due to the way in which the social construct of disability has been defined and its changing interpretation from one of shame and difference to one of pride and being part of the natural human experience. It is important to keep in mind these historical events so as to construct models that enable the most freedom and self-efficacy of persons with disabilities. The disability civil rights movement disrupted the way disability was interpreted or is interpreted, and over the recent decades, numerous contemporary policies have been put in place, underscoring choice, self-determination, community living, economic opportunity, and making supports and services more portable and located in the community, in community inclusive settings. It is important to be aware of such policies and procedures and how these may interact with your CDFI products and services so that the work that you produce results in the desired outcomes as voiced by people with disabilities. You will also learn from existing models and subject matter experts, and be introduced to data sources and inquiry methods that will be useful for informing your product designs. You'll be encouraged to build strategic partnerships with the disability community, which will shed new light on sources and uses of funding within the disability arena that may play a role in how your loans are underwritten and structured. During the face-to-face session, you will access templates to help you and your partners design products, test usability, and monitor performance. Next slide, please. So this is our first poll. We would like to know if those of you on the call today already are working with the disability community. If you could take a minute and please respond to the poll, that would be great. It's a simple yes/no question. Okay, do we have results yet? Okay, great. So we have 64% that are on the call that indicate that you are already working with the disability community, which is great. And 36 of those of you are not. Our next poll, for those of you who are working with the disability community, we'd like to know which types of organizations you're working with. And if you could please participate in the next question by selecting all that apply, that would be great. So your options are self-advocacy organizations, service provider organizations, professional advocacy organizations like universities or trade associations, government agencies, or other. If you decide to select other, please insert in the chat box those specific organizations you work with that aren't listed here. And we'll take a look at the results in the chat box. Okay, what do we have for results? Okay, so largely service provider organizations. That's the winner at 89%, but it looks like there's a good spread. So those of you on the call are represent the range of the types of organizations that we've listed here. We also see in the chat box, we have government agencies listed and alternative finance programs. Those are often found for assistive technology. So that's great. Thank you for participating in the poll. So next slide, please. So what is implied by the term disability? There are many definitions depending on the source you refer to. The Merriam-Webster defines disability as a physical, mental, or developmental condition that impairs, interferes with, or limits a person's ability to engage in certain tasks or actions. The slide presented here describes some of the common types of disabilities that people have in society according to medical terminology. Disabilities such as cognitive or intellectual disabilities, cerebral palsy, speech or hearing challenges, mental or behavioral disorders, combat-related injuries, or autism spectrum disorder. However, I would caution you that in your work, rather than focusing on these labels, emphasis should instead be put on building community or social acceptance. The term disability, according to the ADA, that is the Americans with Disabilities Act, is a legal term rather than a medical term. Because it has a legal definition, the ADA's definition is different than how other acts, such as the Social Security Act, defines disability. The ADA defines a person with a disability as a person with a physical or mental impairment that substantially limits one or more major life activities. This includes people who have a record of history of disability or may have had a challenge with a disability in the past but may not currently have a disability. It also includes people who do not have a disability but are regarded as having a disability. The ADA also makes it unlawful to discriminate against a person based on that person's association with a person with a disability. So it's a much broader definition. What is essential for you to understand is that people with disabilities are people first. Having a disability does not define a person. It is one of many characteristics that collectively make up a person's identity. Experience and disability is a natural part of the human condition. It is not all about medical labels and terminology. Rather, it is often about social attitudes and the environment people live in, which creates impairment, disrupts function, and makes things inaccessible that creates disabling conditions. We will cover more of this in greater detail during the face-to-face training. We simply are providing these definitions here on the slide for those of you who are unfamiliar with the disability community. But these are important clarifications. Next slide, please. So here we have other characteristics of people with disabilities as it relates to the percentage of the population. And as community development financial institutions, it's important for you to assess market characteristics in the creation of new products and services. This data here is based on American Community Survey data. According to this most updated data, the most common type of disability is an ambulatory impairment. This may imply use of a wheelchair or other motor issues that make it difficult to walk or use stairs. Ask yourself, what kind of products might this suggest from the standpoint of your CDFI? Could you imagine home renovation loans, assistive technology lending, accessing building construction or durable medical equipment loans? Those are all examples of what a person with an ambulatory impairment may be interested in, and others. People with cognitive impairments are also prominent, with roughly 38% of the population experience a mental or emotional condition, such as difficulty concentrating, remembering or making decisions. An independent living disability refers to, due to physical, mental, or emotional condition, that a person has difficulty running errands on their own or going to the doctor's appointments by themselves. Often people with cognitive or independent living disabilities may need additional supports and services from the service organizations that we mentioned earlier in the poll. Thus, service providers are important to engage as part of the development conversation because they play a role in the implementation of the goal. The important takeaway from this slide and your challenge during the series is to determine what variations in product features appeal to some more than others. Also to realize that for each of the characteristics or type of disability described here, there's a network of stakeholders that you might engage. However, emphasis needs to be on the individual customer or customer base in learning more about their needs or wants. Systems can't replace or speak for people with disabilities, as their needs and wants may vary or conflict in some cases. Next slide, please. This slide here gets back at the conversation we had earlier about how settings and social attitudes can be a barrier to access. Social attitudes can be helpful or they can be harmful. They can be empowering depending on what's presented. Social myths, assumptions, lack of experience, simple reality of not knowing can lead to challenges with engaging customers with disabilities. As part of the series, you will learn about language use and interaction preferences such that your approach to customer service is competent and well aligned with best practices in etiquette and accessibility considerations. Next slide, please. Universal design takes into account how to make a product or service inclusive and accessible for anyone. Note here, I'm not referring to lending criteria specific to a certain market segment, but rather how to increase usability or uptake of a product. Indeed, the reason this training series is being sponsored is because the collective understanding is that people with disabilities are underserved by CDFIs, and given their demographic characteristics and needs, are likely a good fit with your mission. Imagine that the reason people with disabilities are not accessing your service now is due potentially to their inability to use your application forms, or because marketing materials are not legible due to small print, or because it's inaccessible to screen readers. Universal design consists of 7 principles that are important to keep in mind in reaching people with disabilities, but implementing them in your future will help all your customers, whether they experience a disability or not, because universal design accommodates the person with the most barriers to access. So this is a good thing. It's a good practice for your business model. Next slide, please. As discussed previously, statistics can be helpful in better understanding product design and fit and market potential. As you see here, there are numerous disparities between the general US population and the population in the US that experience disabilities when it comes to important demographic and socioeconomic status indicators. For example, the employment gap is a serious one, with roughly only 36% of the population of people with disabilities working. This is a 41% employment disparity compared to the general population. That's significant. People with disabilities are also twice as likely to be poor and have less than a high school education. Only 14% are said to indicate an undergraduate degree. Ask yourselves, your staff, your community, how can your CDFI not only use these statistics to inform your products, but also how can your CDFI address these disparities when it comes to other community finance work you do? In other words, how can people with disabilities not only borrow, save, and conduct financial transactions with you, but how can they become employed in your community's workforce efforts? How can poverty rates be reduced through other asset building initiatives your organization promotes? How can they become integral to your planning efforts to help drive positive change consistent with your CDFI mission? That's what our work in LA will result in. Next slide, please. Some of you may be familiar with this study that was completed by the National Disability Institute recently, which utilized data from the FDIC National Survey of Unbanked and Underbanked Households. Similar to the statistics we just reviewed on socioeconomic status, in this study, people with disabilities were found to have significant banking disparities than other unbanked or underbanked households that took part in the survey. For example, people with disabilities as a market were found to be much more likely to be underbanked, much less likely to have a savings account, more likely to use alternative financial services, lack funds for a deposit account, and are twice as likely to have no credit. But as you will hear from our CDFI presenters during the face-to-face session, their loan repayment rates are great. AT loan programs are a great example of that. Next slide, please. As mentioned previously, there are many stakeholder organizations that have a vested interest in the supports and services of people with disabilities. And some of these organizations are specific to a particular type of disability or type of service or support that a person may receive. Listed here are the types of organizations we will discuss. Self-advocacy organizations, these are considered by and for people with disabilities to speak, which are, sorry, I lost track here, are considered by and for the people so that people with disabilities are advocating for themselves and assisting other people with disabilities to advocate for themselves rather than a professional agency. These are often statewide and national organizations, but have local chapters that actively engage people with disabilities themselves in moving activities forward. Service provider organizations such as home health agencies, case management entities, employment providers, direct support staffing agencies, and community mental health centers. These are all considered service provider organizations that connect back to those references I made earlier on the different types of people with disabilities. Then there are also professional advocacy organizations that refer to quasi-government entities that by law or otherwise, its mission is to advocate on behalf of persons with disabilities. Some examples include disability rights centers or a nonprofit entity that promotes civil rights of persons with disabilities and continuing to advance equality of opportunity and ensuring that their human rights are monitored. Government agencies are those agencies determining eligibility for services and supports, regulating and monitoring services that are funded by the government and that people with disabilities qualify for based on their specific eligibility determination. It is important to be aware of the stakeholder landscape due to the fact that these entities may be your partners or have some influence in your success. Next slide, please. So it's really important to engage these stakeholders. Again, you always want to keep in mind the person with a disability and their own voice, but engaging stakeholders is really important. And we're confident that a major success factor for CDFIs to be effective in this work is better understanding the organizational landscape of these networks. We have a number of recommendations for you to consider as part of your planning endeavor to get to know these stakeholders. We hope some of this will occur prior to your arrival in LA. It'll be a big part of the conversation when we're there together face to face, but we anticipate there'll be lots of work when you leave LA as well in engaging these partners and relationships. So some of our recommendations include networking with nonprofits in your community that support people with disabilities. Another recommendation we have is forming an exploratory committee. So if you're interested in serving this market, it would be a really good idea to engage disability community leaders in that effort. Consider having a co-chair for the committee that is a disability leader and craft a shared agenda on what you aim to achieve. Other suggestions include convening community-based forums, such as focus groups, representative of people with disabilities. Engage specific disability organizations, such as an independent living center, vocational rehabilitation, or other nonprofits to explore how your services may help to meet the needs. To get started on better understanding the landscape, in the next slides we'll go over more information about the types of these organizations involved and the work they do in the community. Next slide, please. Okay. So independent living centers is one type of organization that was mentioned previously, and these are consumer controlled, so controlled by people with disabilities that tend to be cross-disability organizations, so representative of more than one type of disability. And they're operated in local communities by people with disabilities. Centers for Independent Living provide an array of services that people with disabilities can use in order to make their own choices, direct their own lives, and live fully in their community. So these centers are all about helping people take charge of their own lives rather than being a service provider organization that tells people what they're going to get for services. So this is all about personal empowerment at Centers for Independent Living. People First is another well-known national organization that has state and local chapters. This also is a consumer-run organization dedicated to people with intellectual and developmental disabilities and assists peers in understanding their rights, speaking up for themselves and making their own decisions and conducting their own problem solving. Again, another example of an organization where it's consumer-run, so run by people with disabilities. Autistic Self-Advocacy Network is another example. This is a national grassroots organization run by and for people with autism. The staff supports self-advocacy, civil rights, and civil rights work to improve public perception of autism. Self-Advocates Becoming Empowered, another consumer-run organization that works to ensure people with disabilities are treated as equals. And then we have the National Association of the Deaf and the National Federation of the Blind that advocates for individuals who are blind or deaf. Next slide, please. So service provider organizations, if you recall in the poll, that was the type of agency that most of you are engaging for those of you who already have established relationships. So there are a lot of different types of organizations that are considered service providers. I know in my own state, just in the employment arena alone, there are over 72 employment providers in our small state of New Hampshire. But these organizations are bulleted here, are common in every state across the country. Aging and Disability Resource Centers, that's a single point of entry into long-term services and supports for older adults, people with disabilities, caregivers, veterans, and families. There are many different types of service coordination entities that coordinate services for people. Often these services are funded through Medicaid and other funding sources. So service coordinators typically will help a person develop a plan that they're working on that relates to their disability. And service coordinators will monitor the fulfillment of that plan and make sure it adheres to funding requirements. Personal care assistants, such as home health agencies and other direct support providers. These are service entities that support people with eating, bathing, wheelchair transfers, driving assistance, in-home supports. That's what I mean by personal care assistants. They can also assist people in the workplace to make sure people get to work and have what they need in the workplace. Direct support services. These are commonly referred as for people with intellectual and developmental disabilities to live in the community and to be able to work in the community. Vocational rehabilitation is a state entity, but also it contracts with other vendors that provide job development, job training, job coaching. And then public transportation is a huge factor for people with disabilities, and there are different types of funding categories that pay for different types of public transportation, in addition to your typical train or bus system or rail system. So there are special alternative forms of accessible transportation as well for people with disabilities. So these are really important stakeholders and service providers.
Toby, there's a question in the chat box. Angie Miranda asks, will any of the representatives from these groups be at the face-to-face to meet and interact with?
Yeah, so we, unfortunately, our funding for this training is limited to only CDFI, CDFI personnel that the fund approves through the application process. But it's a really key question you ask, and why we're emphasizing so much on in preparation for the training and post-training that you seriously consider engaging these stakeholders in your planning process.
We should mention, Toby, that a few of the trainers work for organizations that provide services for people with disabilities.
Right. Mr. Tom Foley is a leader nationally in a lot of this work, and he will be at the training. He works for the World Institute on Disability. We also have a representative who runs an assistive technology loan fund, someone who specializes in housing, and also has a disability CDFI specific to people with disabilities, CDFI specific to people with disabilities, and myself. So you have a number of subject matter experts that are very familiar with these networks who can guide and support you in the identification of these organizations in your community, as well as people like Michael Swack on the phone or on the call here today, and others who really specialize in CDFI scaling up and product development. So we have a nice mix of subject matter experts.
Toby also has some participants. Anna from the Iowa Able Foundation will also be there.
Oh, that's great. Yeah, excellent. And in case I know I haven't mentioned this yet, but we really want the face-to-face session to be interactive. This webinar is just sort of to set the stage, as it's titled, but we really are hoping that this is very interactive. We want you to leave with a good plan moving forward, so that the extent that you can talk with your colleagues locally before the trip and training, the better, and then really have the intention in mind that when you get back, to really apply this work, you're really going to engage those partners if they're not engaged already. And we'll talk more about that as we move forward here. Okay, so next slide, please. Okay. So these are a number of other types of organizations, and you'll recall in the very beginning I said there's a plethora of organizations, and I think you've gotten the message. There are lots of different types of disability organizations. So protection and advocacy centers, these are groups that are in every state, at least one, that are all about protecting the rights of people with disabilities. Developmental disabilities councils are also at least one in every state. These are all about supporting people with developmental disabilities and their inclusion in the community and their self-determination. University centers of excellence in developmental disabilities. These are entities like the one I work for, which is all about, again, it's all about inclusion and promoting systems change and cutting edge work for people with disabilities. National Alliance for Mental Illness. This is a national organization that has state chapters that are promoting access and supports for mental health and behavioral health treatment. Aging and Disability Resource Centers, and the two other organizations mentioned here we've already mentioned, but these are all really strong advocacy organizations that are all about, you know, protecting rights, but also pushing the envelope and advancing systems change for people. Next slide, please. So as Angie brought up, you know, the other representative of the groups, we know that to really be successful in this work, it takes both perspectives, both types of practitioners working together, because no one, unless you have inside talent and subject matter expertise on disability already, no one expects you to leave as an expert this first session. It's really to orient you to the landscape and the etiquette and some of the needs so that you can really build your capacity. So this is why we're really emphasizing the idea of an exploratory committee. So in terms of engaging those stakeholders, really think about setting up an exploratory committee. Consider cross-disability stakeholder representation. So it's not just enough necessarily to just say, oh, you know, the leader of the Independent Living Center, just to have that one person representing a perspective. There's a diversity of disability, as you can see here, I hope, and really engaging multiple perspectives, perspectives of people with disabilities, perspectives of the service providers, perspectives of people that and organizations that have a role in funding services. Those are all really important considerations. So one of the things that you'll leave with, and we'll walk you through during the session, is a resource map where we're going to orient you to the links and the organizations that you, if you don't already know who those organizations are in your community, will provide that information to you, and you'll leave with that information. So on that note, please bring your laptop. We do want to do some interactive things in the session. So either a phone, if you have a phone that's capable of doing that kind of searching, but a laptop would probably be preferable for you to bring, because you're going to leave with that information as a result of our workshop. Next slide, please. Okay. And I think I pretty much have covered this. Yeah, I think we've talked about this. We can move on in the interest of time. You'll have a few more minutes. You can keep moving here. Oh, keep this, sorry, DeBrittany. So, you know, one of the best ways I've seen this work is by convening meetings and bringing subject matter experts in the disability arena to you to do guest presentations. One of our takeaways from the New Orleans training was the desire of CDFIs to have training for their personnel beyond just the people coming, you know, to our face-to-face session, but rather bring in disability experts to talk about what they do, what does their organization do, how can they help you. And the same is true the other way around, possibly, you know, offering to provide a guest presentation to your CDFI about your CDFI to a disability organization. Other ways that you can learn about the needs that would help inform your products and market potential is reading annual reports to identify what are some of those strategic priorities that these organizations have. And, you know, co-designing a market study. You want a better idea of what the market potential is. By co-designing a market study, you can come together with research questions of mutual interest with your disability stakeholders and your CDFI. What are some data collection methods and procedures? And we'll talk about those in the series, as well as a database decision-making strategy on what some of the needs are. So we're going to point you to some of those data sources that will help you, but come to the session in mind with what some of your questions are, and we'll point you into the direction of those resources. Okay, next question. We have, I think in the interest of time, we should skip here. This, our next poll, this gets back to building the community. We want to know more about you. What type of lending does your CDFI specialize in? And you have the option selecting affordable housing, commercial real estate, community facilities, consumer financial products. And we want to know this because we have some breakouts planned in the afternoon. So this will help us give us a sense of what your expertise is in. And then we'll interpret the poll in a minute. And if you don't see a type of lending or a type of interest you have listed here, please put that in the chat box. And we can interpret the poll now, Brittany, if there's time. Okay, so consumer financial products, 75% of you. Okay, great. But we also have some intermediary lending, affordable housing, commercial real estate, and community facilities. Okay, great. And small business lending, Joseph says. Okay, great. This is great. So I think our subject matter experts and what we've already explored in our first training will be really helpful for understanding what some of your needs may be. Okay, next slide, please. So with that in mind, obviously we're motivated to join this session, and we have a whole 2-day session planned, but if there is something that is just a burning need that you have that you know today that you want more information on, please put that in the chat box. We want to know what your anticipated TA needs are, so that we can try to accommodate that if not already accounted for. Give you 1 more minute to respond to that. And I don't see anything yet on the chat box. Okay, so we'll be discovering that throughout the 2 days, and we'll be revisiting that question as well, okay? So in terms of next steps, we can move on to the next slide. And I know we don't have much more time before we're together in the first week of December. But before the face-to-face training, we have a request of you. And again, this gets back to what we know and we firmly believe is a factor for success. We really would like you to, especially for those of you who don't already have relationships with the disability community, to make attempts before the LA trip to interview one or more stakeholders. Even one is good, but ask them. These are just examples. You can ask whatever questions you want, but as it relates to your area of product specialization. But for the example of small business lending, ask a stakeholder if it's folk rehab that you are working with, or people, individual customers. Asking them what ways would be helpful for those who are self-employed or who are small business owners. What do they need? Yeah, go ahead.
Yeah, a couple quick other things from the chat box. Anna mentioned that marketing is one of the things that she'd like to see. Also, there's a question about, will you be discussing how to complete the CDFI disability application? I assume you're talking about the specific funds set aside by the CDFI fund to apply for. Is that correct?
Yeah, if you can answer in the chat box.
Yeah.
Yes.
Yeah, we'll talk about that as well, yes.
Okay, right, great. And marketing, we have covered in one of our sessions called Core Issues, but this is also something that came up in breakout sessions, and I anticipate it will come up in our breakout sessions, because we're going to ask you and we'll guide you and help you with what your implementation plan is moving forward. So marketing is going to be covered as well. For those of you interested in the consumer lending, ask those stakeholders you already have relationships with or new ones what the needs are. And again, we'll be pointing you to data sources, but this is really more of a qualitative effort that we're asking you to embark on. Just pick up the phone and call some of these organizations, or if you have someone you know that already works for a disability organization, ask them who they think you should ask, and do that networking, and bring that information with you on the day of the training, and we'll take time to debrief about what the needs are. Next slide, please. So listed here, and you'll get lots of material in the manuals that we pass out on the face-to-face sessions. These are links. So after today, Brittany will be sending out the PowerPoint slides. And for those of you who have no idea how to reach these organizations, these are links to the national websites that you can actually do a search and identify who's the independent living center in your area. You can locate, you know, the various self-advocacy organizations in your area. In most cases, each website has like a national map. So if you need help finding the contact information of the organizations to ask these interview questions, go right ahead and access those links, you know, this week and contact them. That would be great. We think it's really important for you to make attempts to do that and bring that information with you. You can advance to the next slide. Yeah. Okay, you can keep going. I want to show you some other links. So these are some of the professional advocacy organizations, so the Protection of Advocacy Centers, state councils on developmental disabilities, like I said, they will have, and Aging and Disability Resource Centers, they will have their mission and their organizational description, as well as their 5-year plans. And in many cases, you'll see, you know, goals of having accessible housing, or, you know, engaging in systems change on workforce development, those sorts of things. So this will give you a sense of the landscape of what's happening in your area and what the organizational priorities are as a primer for those conversations you have.
Toby, there's also another question in the chat box about disability metrics.
Mm-hmm. Let's see, what are some standard disability metrics that should be collected on lending applications or in our portfolio follow-up documents that will not offend people with disabilities? That's such a great question, and this came up the end of day 2 when we were in New Orleans. So we're aware that you have your own performance metrics, and the standard ones that you collect for the CDFI fund or for specific to your organization. This is a fascinating question. We're going to talk more about it, and I'm not trying to skirt the question, but I think as we'll discover when we're in LA together, different stakeholders bring different metrics. So employment rate is really important. That's something that you're going to want to measure over time. But other metrics that are not as commonly understood are inclusive settings. So it's one thing to produce accessible housing, it's another to produce inclusive accessible housing. So these are some of the deeper conversations we'll have in LA. And we'll put some time into that. Our planning group will put time into that before the session in preparation for a deeper dive into that, okay? Next slide, please. We're just trying to show you some links here. So this is just a search function suggestion on how to find the community mental health centers in your area. Developmental service systems, like I said, those are organizations that support people with intellectual or developmental disabilities. These names vary by place. There's no one name for them, so the best thing you can do is really, you know, do a query in Google, and according to your place, your zip code or your town or your city or state, to be able to find that information. Okay, and given we're over time at this point, if you could just advance to the next slide to Brittany. This is contact information. If you have questions, burning questions after the webinar, you can forward your questions to this web address, cdfi@bctpartners.com. This will be sent to you. And we really look forward to seeing you in Los Angeles. Any other questions or comments, Michael, that you want to emphasize? I don't think so. Okay. Thank you very much for joining us today, and feel free to forward an email if you have a comment or question you want to share before the session, and we will see you there.